I'm Alan Windham, Extension Specialist and Professor of Plant Pathology with UT Extension. And I'm going to talk to you about the symptoms of rose rosette. Now, rose rosette is a virus disease spread by an aphid mite. Some of the early symptoms that you'll see are strap-shaped leaves, leaves thinner than normal, maybe some unusual mottling. But as the rosette advances, you'll get dwarf growth, many more shoots than normal. You will get hyperthorniness, many more thorns than normal. Color may be a little bit off. Sometimes the color will be abnormally red. A few weeks later it'll be green, and then it'll go back to red if there's a new flush of growth. The main symptom that we look for are the rosettes. The early symptoms that you might see are some chlorosis, yellowing of the leaves, some mottled leaves, distorted leaves, and as it advances, the plant will die, usually within a few years. And the plant dies because it's unable to store carbohydrates, which allows it to put out a new flush of growth in the spring.
Hi, I'm Mark Windham. I'm a professor of plant pathology in the Department of Entomology and Plant Pathology at the University of Tennessee. And welcome to UT AgResearch's rose plots that are located at the Plateau Research and Education Center near Crossville, Tennessee. We're working with rose rosette disease on roses. Rose rosette is a lethal disease, which you're going to learn a little bit more in a minute. But I wanted to give you an overview of what we are doing with our roses here. Most of these roses are being screened for resistance to rose rosette disease. Many of these roses were selected to be tested because one of their parents showed resistance to this disease, but these roses also have horticultural characteristics that would be considered more valuable than what the parents had. So we screened thousands of roses for disease resistance. 95% of them will fail. And we're only interested in that 5% or less. In some years, it's less than 2% of the new roses pass. Roses are tested for a minimum of 4 years. So this is a very severe test, and it's the only place in the country now where this type of research is being done. In addition to that, we are working with the vector that spreads this thing around. It's a small aphid mite, and in a few minutes we'll talk about that research as well. One of the things that we are doing research on is the vector that transmits the virus, rose rosette virus, that causes rose rosette disease. Now, the vector is an aphid mite. This is much, much smaller than a spider mite. It's microscopic. It's approximately the same size as a dust particle, fine dust particle that would be in a windstorm. It has no wings, no eyes, no nose. It has 4 little legs. It cannot move on its own. It is blown in the wind from one bush to another, and it cannot control where it goes. One of the big questions, though, in controlling this mite is, when does this mite become airborne? The populations have to build to a certain level before this happens, and that is very weather dependent. So we have to be able to understand when this mite would become windborne to know when we might use a miticide to control this mite. Now, to do this, we have this very simple contraption here that is spinning microscope slides that have a compound called tanglefoot on them that makes the slides very sticky. The slides are at an angle, and this angle was calculated so that particles would not be blown away like wind from an airplane wing or a propeller, but instead at an angle where small microscopic particles of practically zero mass would impact the slides. Now, once a week we collect these slides, and then we have to look for aphid mites on their surface. Now, once we know when mites are being spread in air currents, we know when to apply control measures. In late summer, early fall, it's also important to know when they stop ballooning. So these little spinners spin all summer. We collect the slides once a week, and we spend all the time between slide collecting looking at the slides that we collected from the week before. So it's very time consuming, it's very tedious, but it's very important information.